It is possible that at some point in your life you will undergo general anesthesia. What is general anesthesia? General anesthesia is a drug-induced reversible condition that includes specific traits. Unconsciousness, you will not be aware of your surroundings. Amnesia, you will not remember what happened in that moment. Analgesia, you will not feel pain. And akinesia, you will not be able to control your movements. General anesthesia is a reversible drug-induced coma where the brain is disconnected from the body through the use of drugs. During general anesthesia, the patient will go through 3 stages: induction stage, maintenance stage, and emergence stage. Before the induction stage, the patient is awake and responsive to the environment. With the administration of a small dose of a hypnotic drug such as propofol or other drugs, the patient will start to feel sedated, calm, and the eyes will start to close. As more of the hypnotic agent is given to the patient will start to have an irregular respiration pattern that will progress to apnea, and at this point supportive ventilation will be initiated. As the induction stage progresses, the patient will not respond to oral commands and will lose the tone in his muscles. After the induction, general anesthesia is maintained by a combination of hypnotic drugs, pain-relieving drugs, muscle relaxants, and cardiovascular drugs to support ventilation and to support cardiovascular functions like blood pressure and heartbeat. So during the maintenance stage, anesthesiologists have to reach appropriate levels of disconnection of the brain from the body for a surgery to be performed. The final stage of general anesthesia is the emergence stage, and this stage is a passive process that depends on the amounts of drugs that were administered to the patient, how strong or how potent they were, and depends on the characteristics of the patient. The recovery from general anesthesia is assessed by the progressive reconnection of the brain with the body. Patient will start to have spontaneous ventilations, the heart rate and blood pressure increase, and we will start to salivate, to tear, and they may start to respond to painful stimulation. During the emergence period, the anesthesiologist will perform extubation as long as there is enough spontaneous ventilations. At the end of the emergence stage, the patient should be able to answer simple questions and to convey any discomfort that he may have, such as pain or nausea. General anesthesia works, but how exactly anesthetic drugs induce and maintain this behavioral state remains an important question in medicine and neuroscience that is not fully answered yet.